Bismillahirrahmanirrahim. Quote of the day is Allah does not burden a soul beyond that it can bear. My name is Dr. Aamna Khalid. I am resident of community medicine. Today I will present the topic of different methods of contraception under the kind supervision of Professor Dr. Saira Afzal, who is Dean Institute of Public Health, Lahore. So first of all, we will see what is family planning. Family planning actually refers to the ability of individuals and couples to anticipate and attain their desired number of children. Spacing and timing of births through contraceptive methods and treatment of infertility is a part of it. And it is a core component of reproductive health, and it's an essential part of the universal health coverage. Objectives of family planning include that it prevent unintended and unwanted pregnancies, promote optimal birth spacing of 2 years or more, that's the recommended spacing, to reduce maternal, neonatal, and infant mortality, empower women and couples to make informed choices, improve socioeconomic development, contribute to the Sustainable Development Goal 3, good health and well-being, and Goal 5, that is gender equality. So the ideal spacing as recommended by WHO is at least 24 months, that is 2 years, between a live birth and the next pregnancy. Uh, Shorter interpregnancy intervals increases the maternal anemia, increases the risk for preterm birth and low birth weight and neonatal mortality. So now we come to the methods. We will first classify the methods. There are temporary methods. We can also name them as spacing methods. They include natural methods, barrier methods, hormonal methods, intrauterine contraceptive devices, and emergency contraception. And the second one is permanent, which we name as limiting methods, male sterilization and female sterilization. Natural methods include lactational amenorrhea method, fertility awareness methods, periodic abstinence, calendar method, basal body temperature, cervical mucus method, and coitus interruptus. We can see in the picture that there is a calendar which shows the fertility days. So avoiding the fertility days is one of the natural methods um, to get the goals of family planning. First of all, we will go through the detail of lactational amenorrhea method, that is LAM. Criteria for LAM is there are three criteria and all of them should be met to achieve the goal. First one is baby age less than 6 months, exclusive breastfeeding, and mother is amenorrheic. This is the pictorial demonstration of the same concept that there are three criteria. If either the menses are returned or breastfeeding is supplemented or baby is older than 6 months, if any of the question is answered as yes, then we have to begin with another family planning method. So the benefits of this method are that it's free of cost, no hormones, promotes breastfeeding, and no medical side effects. When we have to when we should recommend this method when there is the early postpartum period, exclusively breastfeeding mothers, and when not to use when there is supplementary feeding has started, and menses have returned, and baby is more than 6 months. Side effects are none for this method, and fertility return immediately once any criteria fails. And a patient or women should be concerned about the thing that all three criteria are mandatory, and it's not a long-term method. The patient has to switch to another method before 6 months, and no protection is provided by this method to the STIs, that is sexually transmitted infections. Then the second one is fertility awareness method. The benefit for this is that a patient has no cost for it, no side effects of this method, acceptable to the religious groups as well, and when to use when the women have regular menstrual cycles, and highly motivated couples. When not to use when there are irregular cycles and poor compliance or understanding. Side effects are again none for this method as well, and the fertility returns immediately. And patients should be concerned about that they require proper training and compliance for this method. And there is higher failure rate than the modern methods used. We will discuss further, and it requires the partner cooperation as well. So next one is the barrier methods, which includes male and female condom, diaphragm, cervical caps, and some spermicides. Condoms have the benefits that they protect against the sexually transmitted infections and HIV as well. They are easily available and there are no systematic side effects. When to use where in the adolescent couples, unmarried individuals as well, and dual protection is required. Side effects are the some people can have latex allergy, reduced sensation, and breakage or slippage. Return of fertility is again immediately, and patients should be concerned about correct and consistent use. Single use only, that should not be repeated, and a proper storage as well. Then comes the hormonal methods. Hormonal methods includes the combined oral contraceptive pills and the progestin only pills, POP, injectable contraceptives, and implants. First of all, we will see combined oral contraceptive pills. The benefits of this method are they are highly effective. They regulate the menstrual cycles as well as decreases the dysmenorrhea and menorrhagia, decreases ovarian and endometrial cancer risk, and some breast diseases as well like fibroadenoma and fibrocystic diseases. When the woman is healthy, she's less than 25 years, she's non-smoker, and there are no major medical illness. When not to use when she has hypertension, when she is giving history of deep venous thrombosis or pulmonary embolism, she has migraine with aura, breast cancer, a smoker with age of more than 35 years, then this method combined oral contraceptive pill is contraindicated with all of these symptoms and signs. Side effects include nausea, headache, breast tenderness, and rarely it can also lead to thromboembolism. Fertility is returned after 1 to 2 cycles and some go 3 months as well. So patient should be concerned about a daily intake at the same time, usually at night because it has the side effect of nausea. Miss pills rules as well because it's taken for 31 days and then skip for 7 days. And then this warning signs of X. X means that it has the side effects of causing pain in head, eyes, chest, abdomen, and legs. And there is no protection for STIs, that is sexually transmitted infections. Then the second pill is progestin only pills. It's safe in lactation and it's estrogen free, so the side effects caused by estrogen are not faced in this case. When to use when the mother is breastfeeding and estrogen is contraindicated in that woman. When not to use when she has breast cancer and poor compliance. Side effects are mild like irregular bleeding and amenorrhea. Fertility returns immediately, and patient should be concerned about that she must take the pills at the same time daily, and even short delay can increase the failure. Then the next hormonal method, is injectable contraceptive, which includes dipomedroxyprogesterone acetate, and the dose is 150 milligram, which is given intramuscularly after every 3 months. The benefit for the injectables are that they are long acting, and we can also name them as LARC. No daily compliance issue is faced by the person, and it's safe in lactation as well. When we need to avoid these injectables, when the patient is having breast cancer and unexplained vaginal bleeding, undiagnosed vaginal bleeding is there, severe osteoporosis risk she is having. And the side effects are that there are irregular bleedings progressing to amenorrhea, then weight gain, headache, and decrease in the bone mineral density. which is reversible, by the way. All right, then, and the fertility returns after 6 to 12 months. So the person should be concerned about the delay of fertility that is expected, and it will return after this duration. And regular injections are required. Adequate calcium intake should be advised. Then the third hormonal method is the implant. The duration of its efficacy is 3 to 5 years, and the benefits are that it's highly effective, long-term, reversible. Again, it comes under the category of long-term LARC, uh, and it's safe in lactation again. We can see in the picture, they have shown that how a small contraceptive plastic rod is placed under the woman's skin in the upper arm, and they have shown the size that it's 3 centimeter, and by using an applicator, they have placed the implant under her skin. When not to use the implant as well, when again she's having breast cancer or unexplained bleeding, side effects include irregular bleeding, amenorrhea, headache, and acne. Return of fertility occurs after 1 to 2 months, and patient should be concerned about the bleeding changes that they are common, and um, this requires the trained provider as well, that they should go to the trained provider, not some cracks and that kind of thing. All right, the intrauterine contraceptive devices include copper IUCDs, contraceptive device, and hormonal intrauterine contraceptive device. You can see in the picture that it's in the shape of T, and it's the two arms of T are placed near the fundus, and the tail is seen in the cervical area. So we will first go through the copper IUCD. The benefit is that it is long term. It gives the benefit till 10 years. It's hormone free and can be used as an emergency contraception as well. When not to use, when there is active pelvic inflammatory disease or distorted uterine cavity, and heavy menstrual bleeding. Side effects include heavy menstrual bleeding again, dysmenorrhea and spotting, and the fertility returns immediately after the removal of device. And patient should be concerned about the thing that she has to check the thread monthly, and she should follow her physician and or gynecologist for any change, and if she cannot find the thread and initial bleeding is expected, and she should also be concerned that no protection is provided by this method against sexually transmitted infections. Then is a hormonal IUCD, which includes levonorgestrel and comes with the name of Mirena. Mirena has the benefits of decreasing menorrhagia and dysmenorrhea, and a long-term effect is provided till 5 years. Side effects includes initial spotting, amenorrhea, and the fertility returns immediately. Mirena can also, the benefits includes decreasing menorrhagia and dysmenorrhea, so it can also be used for the treatment of endometriosis as well. And then comes the emergency contraception, which includes levonorgestrel pills. The dose is 1.5 milligram, a single dose, and it has to be given within 72 hours. Side effects includes nausea and irregular bleeding, and counseling should be done regarding that it's not a regular issue. It cannot be used for as a regular or as a regular use, and it's not an abortifacient. Emergency contraception includes the pills as well, and as we have initially discussed, the copper IUCD was also labeled as emergency contraception if used within 5 days. Right. When then we have permanent methods, which includes male sterilization and female sterilization. Male sterilization, the procedure is a vasectomy, and the benefits of it are that the simple and safe method, more cost effective than female sterilization, and the side effects include mild pain and a rare infection. And counseling should be done that they have to manage for a backup method for 3 months, and because the fertility stops after 3 months. Then the female method is tubectomy or tubal ligation. Benefits are again that it's a permanent method and one-time procedure, and she should be counseled about that. That it's an irreversible method, so it should only be used when the family is complete and the both partners have given the consent. In informed written consent is essential in this case. We can see in the picture that how they have ligated or clipped or band or tied and cut the fallopian tube. This is the summary of the side effects and the return of the fertility time. Then, in case of condoms, the major side effect is allergy, and the fertility returns immediately. In case of combined oral contraceptive pills, the major problem is nausea and deep venous thrombosis, and fertility returns after 1 to 2 cycles. In case of progesterone-only pills, irregular bleeding can occur, but the fertility returns immediately. In case of the injectables like with progesterone acetate, a weight gain can occur, but the fertility is delayed 6 to 12 months. Implant can cause irregular bleeding, and the fertility returns after 1 to 2 months. IUCDs can cause heavy bleeding, but the fertility is returned immediately. And sterilization is a surgical procedure which is permanent. So these are the counseling principles and that a counseling of the person should be client-centered approach, informed choice should be allowed, and the physician should respect the reproductive rights of the patient, explain benefits, risks, and alternatives, and address the myths and misconceptions as well. These are the effectiveness of different contraceptive methods that implants, IUCDs, and male and female sterilization are more than 99% effective. Injectables like medroxyprogesterone are 94% effective. Combined oral contraceptive pills are 19 to 91% effective. And male and female condoms are 87 and 79% respectively. Fertility awareness method is 75 to 88%. Lactational amenorrhea method 98%. When all the three criteria are met, this is a condition. Emergency contraception is 85 to 95% effective. So the preferred choice that which method has to be used in which women. If the woman is in the phase of postpartum, like 0 to 6 months, and she is breastfeeding, then lactational amenorrhea method, although it is temporary and counseling has to be done, progestin only pills can be given, and the IUCD. In breastfeeding women, if she is breastfeeding and the period is for, after 6 months, then progestin only pills, injectables, implants, and IUCD are the preferred choices. If the woman comes and asks for long-term spacing, then IUCD implants and injectables are the preferred choices. If the woman has completed the fertility family and asks for a permanent method, then female and male sterilization can be done. If the woman has contraindication to estrogen, then the other methods are progestin-only pills, injectables, implants, and IUCD. If the women are at risk of STIs or HIV, then condoms can be used. One method recommended by WHO for the selection of the best method is the medical eligibility criteria (MEC wheel). WHO MEC provides the evidence-based guidance, has determined who can safely use which contraceptive method. It's applicable to individual counseling, public health programs, and clinical decision making. It ensures safety, effectiveness, and informed choices. These are the WHO MEC categories. The first category means that this method can be used in all the circumstances. Second category means that the method is generally safe, but careful counseling is advised. Category 3 means that the method is usually not recommended and used only if no better option is available. Category 4 means that method is totally contraindicated and it must not be used. This is the WHO MEC wheel. In the outer line, we can see different conditions with which a female can come, and in the inner circles, there are different options of the contraceptive methods available. How to use this method? First of all, we have to identify the client's age, postpartum status, breastfeeding status, and medical conditions, which is mentioned in the outer a circle, and then we have to select the contraceptive method being considered. Then we will rotate the MSc wheel to align the medical condition with the method, and we will read the displayed MSc category, either it's 1, 2, or 3, and then according to the category, we will choose the eligibility, and we will choose and exclude the method accordingly, and that the method can be used in this female, in this particular female with some particular conditions or not. So this was all about the topic. Now we come to the bits of MCQs. The first question is, a 24-year-old woman delivered a baby 3 months ago. She's exclusively breastfeeding day and night and has not resumed menstruation. She asked for a temporary method of contraception without using pills or devices. Which method is most appropriate? Option A, copper IUCD. Option B, progestin only pill. Option C, lactational amenorrhea method. Option D, male condom. And option E, emergency contraception.
C.
Yes, C is the right answer. But as we know that we have to properly counsel her about the 3 criterias of lactational amenorrhea method as well. Then question number 2 is, a couple wants a contraceptive method that provides protection against sexually transmitted infections along with pregnancy prevention. Which method should be recommended? Option A, oral contraceptive pills. Option B, copper IUCD. Option C, injectable contraceptive. Option D, male condom. And option E, implant.
D.
Yes, option D is the right answer. Condoms can protect against infections. Question number 3 is, a 35-year-old woman with hypertension and a history of deep venous thrombosis request contraception. Which method is contraindicated? Option A, progestin only pills. Option B, copper IUCD. Option C, combined oral contraceptive pills. Option D, male condom. And option E, implant.
C.
Yes, option C is the right answer. Question number 4 is, a woman seeks a long-acting reversible contraceptive effective for up to 10 years with no hormonal effects. Which is the best option? Option A, a levonorgestrel implant. Option B, option B is implants. Option C, copper IUCD. Option D, injectable contraceptive. And option E, progestin only pills.
B. C.
C is the right answer. Copper IUCD is effective up to 10 years and non-hormonal as well. Question number 5 is, a woman presents 4 days after unprotected intercourse and wants to avoid pregnancy. Which method is most effective at this time? Option A, levonorgestrel pills. Option B, ulipristal acetate. Option C, copper IUCD. Option D, combined oral pills. And option E, progestin only pills.
A.
No, it's option C. Because she presented at 4 days, levonorgestrel pills has to be used within 72 hours. That becomes 3 days. And as I told previously in the slides, that copper IUCD can be used until 5 days. So at 4-day, copper IUCD is a preferred choice. Levonorgestrel will not function in at this time. Question number 6 is, a 28-year-old breastfeeding mother wants contraception and refuses daily pills. Which is the most suitable method? Option A, combined oral contraceptive pills. Option B, progestin-only pills. Option C, injectable contraceptive. D, calendar method. And option E, emergency contraception.
C.
Yes, C is the right answer. Although progestin-only pills can also be used for in breastfeeding mother, but as she has refused, so injectable is the option now. Question number 7 is a couple has completed their family and desires a permanent method. This method is the best and most cost-effective. Option A, tubal ligation. Option B, copper IUCD. Option C, implant. Option D, vasectomy. And option E, injectable contraception.
D.
Yes, it's the right answer. Uh, and then comes question number 8. A woman complains of heavy menstrual bleeding and also wants long-term contraception. Which method provides both benefits? Option A, copper IUCD. Option B, male condom. Option C, levonorgestrel. Option D, implant. And option E, calendar method.
B.
Um, as she is having heavy menstrual bleeding as well and wants a long-term contraception, so levonorgestrel IUCD is the right choice in this case because it's a hormonal method and it will control the heavy menstrual bleeding as well. Question number 9 is a woman misses her combined oral contraceptive pills for several days. What is the most likely consequence? Option A, reduced cervical mucus. Option B, increased endometrial thickness. Option C, risk of ovulation and pregnancy. Option D, increased contraceptive effectiveness. Option E, immediate infertility.
C.
Yes, option C is the right answer. Last question is a 22-year woman wants a method that requires no user compliance after insertion and is reversible as well. Which method is ideal? Option A, male condom. Option B, oral contraceptive pills. Option C, injectable contraceptive. Option D, implant. And option E is tubal ligation.
A.
No, D is the right answer as uh, um, um, it does not require any compliance after insertion and reversible as well. So this is the answer key. This is the YouTube channel of Institute of Public Health where this presentation will be uploaded later on. Thank you.
Thank you so much, Dr. Aamna. It was a very informative presentation.
Thank you, Dr.
Thank you, Dr.